So working with a swimmer and laser therapy and tape is extremely effective. So we're going to concentrate the laser therapy in a few places prior to swimming event and even afterwards. We want to really do a lot of treatments down here in the lower trapezius and latissimus muscle and thoracolumbar fascia. And if you think about it logically about how a swimmer is going to be into that extension pattern for long periods of time, to use the opposite arm towards opposite hip, we want this area to be nice and supported and make sure it's got good communication from one side to the other. So we're going to take the massage ball, and we're going to go all over the lower trapezius and the latissimus muscle and thoracolumbar fascia, close to the spine and out to the side. And this is great because it's also going to hit fibers of the transverse abdominis, which is the belt muscle that wraps around you to form a support cylinder of stability. And where they meet here close to the spine, they're often very, very tight. We're going to go up and move into both sides in the posterior deltoid and rotator cuff region, particularly the infraspinatus and supraspinatus. The swimmers will get a lot of rotator cuff issues or impingement issues in the shoulder. So from this position, I'll be able to come underneath and get right on the infraspinatus, come out on the side, get under the teres major, teres minor, posterior deltoid. A lot of issues where swimmers get complaints. And you'll also be able to tie in a little bit to your latissimus muscle and some fibers of your serratus anterior. I'll be able to come up into here and get the supraspinatus from the top, right up on where the trapezius is, and even into the deltoid. Doing a laser treatment here prior to a swimming event, you're going to increase range of motion, blood circulation, and supply. Make a huge difference on the stabilization and control of the shoulder blade as well. And then right after this treatment, you're going to do both sides. We're going to lock it in with a Rocktape. So after you've done the laser to the thoracolumbar fascia, we're going to put a strip of decompression tape across there, and we're going to use the 4-inch Big Daddy tape. And I like to tie in here lower fibers of the trapezius and the lat, the thoracolumbar fascia, and some of your obliques. So we're going to go right around T12 L1, tear it in the center, and this is going to give you that support mechanism when they're into the stroke of the arm and the leg. So they're always in a little bit of extension, if not hyperextension, when they're doing the swimming. So right across here, stretch about 50%. Lay the center down. Don't stretch the ends. So this will give the lift and help that bridge across from here to the other side. So if we're gonna tape a line, a functional line for a swimmer, we can go from the wrist into the forearm, down into the arm, into the deltoid, and go into the shoulder blade a little bit. Okay, so I'm going to take a long strip. Remember, I've already lasered in this area. Okay, so we want to stretch the tissue, so I'm going to have the wrist in flexion. I'm going to go right on the back of the hand to lay my anchor point. And then now I'm going to be able to control the tape where I want it to go. So I'm going to go on the back of the forearm. Then I'm able to come and turn the tape up the arm. And then now I can go up around the shoulder blade and then start to tail into the lower fibers of the trapezius muscle that come into play a lot. So if I'm going to come in here and I've actually got some clothing that I need to get around, this is very, very simple. So if they have the swimsuit on, I'm just going to take this part of the tape here, and if I pull this through, the tape just follows along right where I want it to go, and it lays down just like that. So this tape will alleviate a lot of pressure that people feel pain and discomfort from up and through here. That's to give them better stroke ability and longer performance, endurance, and durability.